Brain cancer is the eighth most common cause of cancer related deaths in the UK, with thousands of cases diagnosed every year. It's a complex disease because there are many different types of brain tumors, which can be either benign or malignant. Among the most common are gliomas, including astrocytomas and glioblastomas, as well as meningiomas and, particularly in children, medulloblastomas. Doctors classify these tumors on a grading system from 1 to 4. Grade 1 tumors grow more slowly and are less aggressive, while grade 4 tumors are the most dangerous. Glioblastomas, for example, are always grade 4 due to how quickly they grow and spread. Diagnosis often involves a combination of MRI or CT scans, a neurological examination, and in many cases, a biopsy, which allows doctors to study tumor cells under a microscope. Symptoms can vary widely depending on where the tumor is located and the pressure it creates inside the skull. Some of the most common include seizures, which affect up to 80% of patients, vision problems such as blurred or tunnel vision, and difficulties with memory or language. Treatment usually combines surgery, radiotherapy, and chemotherapy. For some patients, clinical trials offer access to cutting-edge approaches like targeted therapies and immunotherapy, which are showing promise for the future. Although brain cancer is challenging to treat, ongoing research and improved treatments are helping more people live longer, healthier lives after diagnosis. Prostate cancer is especially common in older men. In fact, around 35% of patients are over the age of 75, and it's currently the most common cancer among men in the UK. Globally, over 1.4 million new cases are diagnosed each year. Interestingly, many men can live for years without knowing they have it because it often remains asymptomatic in the early stages. When symptoms do appear, they might include unexplained weight loss, tiredness, back pain, and changes in urination, since the prostate sits so close to the bladder and urethra. Some men also report blood in urine or difficulty starting or stopping urination. Doctors usually diagnose prostate cancer using a rectal examination, a PSA blood test, which checks for prostate-specific antigen, and if needed, a biopsy to confirm the presence of cancer cells. However, it's worth noting that PSA tests aren't perfect. They can sometimes give false positives, which is why doctors consider multiple factors before making a diagnosis. Treatment depends on how aggressive the cancer is. For some men with slow-growing tumors, doctors may recommend active surveillance instead of immediate treatment. For more advanced cases, options include hormone therapy, radiotherapy, chemotherapy, and surgery to remove the prostate. Excitingly, newer treatments like immunotherapy and precision medicine are being trialed, aiming to attack cancer cells more effectively with fewer side effects. The good news is that survival rates have improved dramatically over the last few decades. Today, if prostate cancer is caught early, more than 95% of men will live at least 10 years after diagnosis. Early detection really does save lives, which is why awareness and regular checkups are so important. Breast cancer is the fourth most common cause of cancer-related deaths in the UK, with more than 11,000 women and around 85 men losing their lives to it between 2017 and 2019. Yes, while it's far less common in men, it can still happen, which is why awareness for everyone is so important. It usually starts in the cells of the milk ducts or lobules, and early detection can make a huge difference. One of the first warning signs is often a new lump or thickening in the breast or armpit. Other symptoms include changes in size or shape, skin dimpling or rash, and sometimes a nipple discharge. Doctors often detect breast cancer through a mammogram, essentially an x-ray of the breast, or through a biopsy, where a small tissue sample is checked for cancer cells. In fact, regular breast screening has saved thousands of lives by catching cancers before symptoms even appear. Treatment depends on the stage and type of cancer. Common approaches include surgery to remove the tumor, chemotherapy, radiotherapy, and hormone therapy. More recently, immunotherapy and targeted treatments have been introduced, designed to train the immune system to recognize and attack cancer cells. These cutting-edge therapies are giving hope to patients whose cancers don't respond to traditional methods. Here's something powerful. Survival rates have improved massively. Right now, about 76% of women in the UK survive breast cancer for at least 10 years. That's up from less than 40% in the 1970s, a testament to the progress in research and awareness campaigns. So remember, regular self-checks and screenings are key. Early detection isn't just important, it's often life-saving. Let's talk about liver cancer, a type that doesn't always get the same attention as breast or prostate cancer, but it's still extremely serious. In fact, it's the sixth most common cause of cancer-related deaths in the UK, with around 3,500 men and over 2,200 women dying from it between 2017 and 2019. So what makes liver cancer so dangerous? Well, the liver is absolutely vital for almost every part of your body's homeostasis. It processes toxins, breaks down fats, produces important proteins, and stores glycogen. If cancer disrupts these functions, in which it often does, it can affect metabolism, detoxification, digestion, even blood clotting. That's why liver cancer can progress fast and become life-threatening quickly. The most common primary liver cancer is hepatocellular carcinoma, HCC. Others include intrahepatic cholangiocarcinoma and angiosarcoma. But not all liver cancers start in the liver. Sometimes they're secondary or metastatic, spreading from cancers in the colon, breast, or lungs. Unfortunately, symptoms often appear late, once the cancer has already grown. These might include unexplained weight loss, a swollen or painful abdomen, and jaundice, the yellowing of the skin and eyes caused by the buildup of bilirubin when the liver isn't processing it properly. Diagnosis usually starts with ultrasound or CT scans. It often includes blood tests, especially to check for elevated alpha fetoprotein, AFP, a biomarker that can be raised in liver cancer. A biopsy can confirm the diagnosis, though sometimes it's skipped if imaging and blood results are strongly indicative. Now let's talk treatment. There isn't one size fits all here. It depends on tumor size, stage, and whether the liver is functioning properly. Surgery may be an option for patients with small isolated tumors. Embolization, particularly transarterial chemoembolization TACE, involves blocking the blood supply to the tumor while delivering chemo directly into it. Thermal ablation uses heat to destroy cancer cells and is often used for small tumors. Radiotherapy is becoming more advanced with techniques like stereotactic body radiotherapy, SBRT, which can target tumors precisely. Then there's chemotherapy and immunotherapy, which are generally used in more advanced cases or when surgery isn't possible. Drugs like sorafenib or atezolizumab bevacizumab have shown success in extending life expectancy, but here's the challenge. The liver's ability to regenerate is both a blessing and a curse. On one hand, it allows for aggressive surgeries. On the other, tumors can grow silently without symptoms. Also, many patients with liver cancer already have underlying cirrhosis, often from alcohol use, hepatitis B or C infections, or non-alcoholic fatty liver disease, NAFLD, which makes treatment more complex. On a positive note, research is accelerating. We're seeing breakthroughs in liver transplants, targeted therapy, and early detection methods. Survival rates are slowly improving, but catching it early remains the best chance for survival. So the takeaway? Know the risks, especially if you have liver disease. Don't ignore persistent fatigue, abdominal pain, or yellowing of the skin. Because with liver cancer, early action truly saves lives. Lung cancer is the leading cause of cancer-related death in the UK, and globally, it's responsible for more deaths than breast, prostate, and colon cancers combined. Why? Because it's often diagnosed late, and by the time symptoms show, the cancer may have already spread. Lung cancer is mainly divided into two types: small cell lung cancer, or SCLC, which makes up about 10 to 15% of cases. This type is aggressive and fast-growing, often linked directly to smoking. Then there's non-small cell lung cancer, or NSCLC, which accounts for around 80 to 85% of lung cancers. It tends to grow and spread more slowly, but is still deadly if not caught early. Every year, about 49,200 people are diagnosed with lung cancer in the UK. That's more than 130 people every single day. Around 60% of those diagnosed are current or former smokers. But here's something important. Lung cancer can also affect non-smokers. Factors like air pollution, radon gas exposure, asbestos, and genetic risk all play a role. Symptoms can be subtle at first. A persistent cough that won't go away, coughing up blood-streaked phlegm, shortness of breath, chest pain, and unexplained fatigue or weight loss are common signs. Unfortunately, many people dismiss these symptoms as being due to a cold, flu, or aging. To diagnose lung cancer, doctors typically use chest x-rays, CT or MRI scans, followed by a bronchoscopy, where a small camera is used to inspect the airways, or a biopsy, to confirm the presence and type of cancer cells. Treatment depends heavily on the stage at diagnosis. Options include surgery if the cancer is confined to one lung and hasn't spread, radiotherapy often used for tumors that can't be surgically removed, chemotherapy, especially for more advanced stages or small cell types, and newer treatments like immunotherapy and targeted drugs, which are transforming outcomes for certain patients by attacking cancer at the molecular level. Now here's the harsh truth. Survival rates for lung cancer are still relatively low, largely due to late diagnosis. According to cancer research, UK, stage 1 has a 5-year survival rate of around 65%. Stage 2 drops to 40%. Stage 3 is about 15%. And by stage 4, only around 5% of people will survive 5 years or more. But here's the hopeful part. Thanks to public health campaigns, better screening, and advancements in personalized medicine, survival rates are slowly improving, especially when lung cancer is caught early. So if you or someone you know has a persistent cough for more than 3 weeks or experiences symptoms like chest pain, fatigue, or coughing blood, don't ignore it. Early diagnosis saves lives, and with lung cancer, early really is everything. Thanks so much for watching. I hope you found this video helpful and informative. If you did, don't forget to leave a like, subscribe, and hit the notification bell so you don't miss out on future videos covering more health topics and science content. Feel free to drop any questions or suggestions in the comments. I'd love to hear from you. Thanks again for your support, and I'll see you in the next one.